Well, turning now to a bit of COVID news, as you've likely seen in the headlines, there's yet another growing subvariant of Omicron. The CDC saying the BA.5 variant now accounts for more than half of the new cases in the country as of Saturday. And today, we got to hear from the governor about whether any public health measures are being considered and how they're taking a look at past COVID regulations. Dave McKinley explains.
In the midst of currently rising case numbers of this, she seems certain.
We're not looking at more restrictions right now.
No need, says the governor.
Because this time around, we have readily available vaccinations. Anybody can get a booster shot. If you're over 50, you can get a double booster, which I've had, as well as the test kits are so widely available. And people are becoming used to dealing with it. They isolate when they've had the infection. They don't spread it to others. But also, we're not looking to institute business restrictions or other restrictions at this time, but always reserving the right if we get into a different situation. But this is going to be more endemic.
Meanwhile, Hochul says the state will soon send out requests for proposals for an independent review of the state's entire COVID response, which was mostly directed by her predecessor.
A complete picture of what happened during the pandemic. The good, the bad, the ugly. This is not just a report to point fingers at what went wrong. I need to create the action plan going forward for future governors and future health commissioners, but it's not just the health area.
She wants a full review on the effects of decisions made for the sake of health.
For example, would we ever again shut down schools if there was a pandemic? Was that the best thing to do? We're dealing with the fallout from that right now. We're dealing with mental health challenges. I want that analysis done. The decisions made regarding what businesses should shut down when. What's an essential business? Who comes back? A lot of decisions are made. Thousands of decisions are made. This is to have a comprehensive place that people can look to and say, do that again, don't do that again. This was great, not next time. And many things were done right, some things not, and I want the experts to tell me.
Dave McKinley, Channel 2 News.